Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Acarbose. Its brand name is Glucobay. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, in this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Acarbose. Then discuss examples of dosing, and then finish it off with side effects with percentages. I put together some slides to go over this information, so let's just jump right into it. So the first thing to discuss here would be the mechanism of action or how this medication works. So Acarbose lowers postprandial blood sugar in patients with diabetes by competitive reversible inhibition of pancreatic alpha amylase and membrane-bound intestinal alpha glucoside hydrolases. In terms of indications or reasons we would prescribe this medication to a patient, we would often see Acarbose used in the treatment of type 2 diabetes mellitus. With respect to contraindications or reasons we would not be able to prescribe Acarbose, well, we wouldn't give this medication to a patient who had a hypersensitivity to Acarbose or to any other component of the formulation. Patients with diabetic ketoacidosis would not use this medication, as this situation should be treated with insulin. Patients with cirrhosis or a colonic ulceration should not use this medication, as well as patients with inflammatory bowel disease or an intestinal obstruction. Now for dosing with Acarbose. So in the treatment of type 2 diabetes mellitus, the initial dose would typically be 25 milligrams orally 3 times daily with the first bite of each main meal. Some patients, however, may start at 25 milligrams once daily and then slowly increase to 3 times daily dosing. For maintenance therapy, the patient can increase the dose at 4 to 8 week intervals to 50 to 100 milligrams orally 3 times daily, again with the first bite of each main meal, and the max dose depends on the weight of the patient. As with all medications, there are some side effects or adverse reactions that patients may experience while using Acarbose. We'll go over some of those here now. Diarrhea may happen 31% of the time, while 19% of patients may experience abdominal pain. 74% of patients may experience flatulence. Alright everybody, that's all we're going to talk about today with Acarbose or Glucobay. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.